So that will be more of a comprehensive check over with the vet. So they're going to check things like the heart rate, see if they have a heart murmur, listen to their lung sounds, check sort of their all over body condition score as well. So things like their weight. Yeah, because your senior dogs are not moving around as much, so they're probably going to be more
Chalk on.
prone to weight gain.
Yeah.
After already being a breed that is already prone to weight gain. So something that we definitely need to keep an eye on. Other things as well would be like your arthritis as well. So do they need something potentially to make them comfortable for their arthritis? Yeah, so there's a couple of different things that your vet's going to check, and often they will recommend potentially, 6 monthly to annually blood tests as well. So just to check and see sort of where they're at. Is there any changes that are concerning, or are they, happy, healthy, which would be great.
Absolutely.
So yeah, just keeping on top of all those sorts of things and seeing if there is any underlying issues that we do need to address in their senior years.
Hello, humans and puggies. Welcome to the Pug Life Show, brought to you by Pug Parties, because your pug deserves to be the best dressed at the party. And you can check out the Pugs and Stripes collection at pugparties.com. I am your host, Donna, and with me are my puggy co-hosts, Rosie and Kenji, with the rescue foster brother Buster. All I can say is welcome back, Pug Pawrents. If you tuned into part 1 of this special 2-part series on pug health and well-being, you'll know we've been diving deep into what it really takes, emotionally, practically, and yes, financially, to keep our squishy-faced companions living their happiest and healthiest lives. One of my biggest goals with the PUGCAST is to give you the kind of information that's not only helpful, but honest, whether that's through heartwarming stories from fellow parents or expert advice from the pros. And today, we're back with part 2 of our conversation with Chelsea, the vet nurse, who is once again bringing her trademark mix of compassion and clinical smarts. This time, we're tackling everything from adult pug care through to their senior and geriatric years. Those years that are filled with extra cuddles, extra naps, and yes, often extra vet visits. From managing dental care to navigating mobility issues, this episode is all about helping you plan ahead and care with confidence, so you and your pug can enjoy every single stage of their journey together. So grab a cuppa and maybe your pug's favourite snacky, because this is an important one. And if you haven't already, make sure to check out part 1, especially if your pug is still in that cheeky puppy/adolescent phase. Now let's zoomie into part 2, because those senior snorts deserve just as much love as the puppies do. So we'll quickly talk about nose jobs.
Yeah.
Because this sort of at the adult stage, they're fully grown. If they're going to grow anymore, it's out, not up.
Very true.
And so, I mean, it is called BOAS, so it's the brachycephalic obstructive airway surgery or symptom / surgery. I always lovingly refer to it as the puggy nose job.
Yes.
How it's quite interesting. This is something that I think it's probably the other thing that causes the most conversation at play groups is some believe that it shouldn't be done. Other people believe it shouldn't be or should be done, shouldn't be done. Some vets are this way, some are that. The question I'm going to ask is what are the signs that a vet is looking for? And then obviously, what do you do to fix it? So, I mean, I know I've had a number of pugs, but there are people out there who haven't done it yet or haven't thought to.
Yeah, absolutely. So exactly as you called it, the bolus surgery, and it can involve a few different things. So the narrow nostril is what you tend to sort of see, and what you tend to hear as well is sort of that snoring sound. People will refer or may say that my pug snores while he's awake. It's not actually necessarily what they're doing. It's actually called stertor and strata. So it's not so much a snore, but it's the wheezing sound as well as that deeper sound as well, which sounds like the sort of snorting sound, I suppose. So that's what we're hearing with that. So I guess what we would look at, which vets can sort of diagnose during just a clinical exam, would be able to just look at the narrowing of the nostril. So how small is it? Can they breathe normally from it? Or is it too close together or too narrow that they can't necessarily breathe correctly? Just as, I guess, just imagine if you had a cold forever. You know how frustrating it is when
Mm.
you've got a cold and you can't
You
breathe
can
out of your
test it.
nose?
Yes.
And it really impacts you a lot. I know for me, when I get sick and I have a blocked nose, oh, it's awful. So
Yeah.
imagine that constantly. So just that real sort of almost desperation for trying to get air into your lungs.
Mm.
The other thing as well is the soft palate they may do surgery on as well. So it depends on, again, what that pug requires. Sometimes they might just only need to do the nostrils. Sometimes they may also need to do the soft palate as well. And that, again, relates to the quality of life of the animal too. So things like, it might help with things like regurgitation. So if you're noticing, when they're eating and drinking, they're vomiting or
Yep.
gagging, can help with that. As we said before, of course, the breathing is what they're going to
Yep.
be able to help with as well. So getting that oxygen into their lungs. So yeah, it does affect quite a few things for our little pugs. And I think just having a chat with your vet about it, do they need it? Do they not need it? Will really sort of be determined by the vet that you speak to, and they may refer them on to a specialist as well. So I guess that's something to keep in mind, that as well can be quite costly.
Mm.
Um, I haven't seen too many of them, so I can't personally say from experience the pros and cons of them from what pug owners, may be discussing. But for me and from what I've done research in and what I've seen is that it always seems like it's a good benefit for the animal.
Mm.
As well as regulating body temperature, actually, that's another thing too. So
Yeah.
we know that, yeah, pugs can, um, they can have, yeah, issues regulating their body temperature. So, having that BOAS surgery can actually help impact that. So help make it a vast improvement of their body temperature to avoid that hypothermia. So
Mm.
yeah, that's another part of that quality of life as well.
It is, and it's sort of like it when Rosie went to get hers in, she was the last one. So she had the nares, so the nose, and they basically I find it funny, they use the term shave. Doesn't feel like a shave, feels like a cut,
Yeah.
but they
Yeah.
shave the inside of the nose so that it broadens it out, and
Yes.
they can actually nick the side of the nose as well. Um,
Yeah.
and then when you were talking about the soft palate, the term that I hear used a lot is elongated.
Yes.
And it always amazes me. It feels like they've just gone and taken like a meat shaver, but they shave off the back of the tongue basically to open up the top of the throat. That's my understanding of sort of the two key operative procedures to increase airflow. Is the best way to put
Yes.
it.
Yep,
Yeah.
that's correct. Yeah.
And it
Yep.
and same thing again, it's quite an involved surgery. So this is not a quick nip and tuck.
No, that's right, yeah, and that's usually why a specialist would do it. It's not something that's usually done in a GP practice unless there's a specialist surgeon or someone who, yeah, knows how to do them would do that, or as well if they have the correct equipment for it as well, because they do need special equipment to sort of hold that mouth open quite wide while they're doing the surgery.
Mm.
So, yeah, that can be quite costly. I can't give you an approximate on that one, unfortunately. I'm not
No.
quite sure.
No, that's
But I would
okay.
say it would be in I'm sure
It's
you know.
it's it's in the thousands. If someone's quote, I would say if someone was quoting you less than $4,000, I'd be asking why. It's
Yeah.
it's like the dental work. It is a very specialized procedure, but um, with the breeding standards the way they are, it's becoming more and more of almost a necessity for a pug these days for improving. Like Rosie has reflux, so even though
Mm.
and she also has a collapsed larynx.
Oh, wow.
So Winston, and that was from not having enough air, and
Yeah.
so Winston passed away because his trachea collapsed because of the negative pressure because the vet at the time that we had advised that Winston didn't need surgery for his airways. He was fine. And so what we discovered after it was basically, we did the surgery, but it was too late. Like the damage had already been done because
Yeah.
he was a lot older when we started to see the consequences of him not having had that surgery. So, and that was on us. That was a lack of knowledge. And I think in some ways, possibly a lack of knowledge of that particular vet at the time. So, and there's no blame. Like it's you know what you know at the time. And that's why I think this
Yeah.
podcast is actually really important, talking about this so that people can go and talk to their vet and say, look, I get this a lot of money, but I also understand that this might actually be something that my pug actually needs, and it's not worth having before they're fully grown.
Yes, yeah, absolutely. So I think generally the surgery is performed around 2 years of age onwards,
Mm.
just once everything's developed fully and we can sort of get a full understanding of what they look like and how their anatomy has formed as well.
Mhm.
But yeah, collapsed trachea,
Yep.
that sounds awful. So you
It
can
was.
only imagine that, yeah, pugs, unfortunately, they are bred the way they are.
Yes.
Um, so that's why, yeah, doing the surgeries or intervening sooner rather than later is gonna be a lot of benefit for your animal as well. And yeah, that's definitely gonna impact their quality of life too,
Mm.
going forward. And I guess, yeah, besides just the surgery cost, there is ongoing care afterwards as
Mm.
well. Usually you'd take your pug to a emergency centre so they can have that sort of 24-hour overnight care as well.
Yeah.
So yeah, they do need to be sort of watched quite closely. So yeah, if you are getting that procedure done in, say, a GP, I'd highly recommend having a chat with the vet. They're probably already gonna recommend it, but if they aren't, then I'd say to definitely go to an emergency practice just so they can be watched overnight. And
Mm.
again, that can, be quite costly as well for pet owners.
Oh, yes.
But something unfortunately that, yeah, is definitely necessary.
Oh, absolutely. It's sort of, I think I was out for like 6 weeks with Winston when we ended up doing his surgery. He had more than just
Mhm.
the BOAS surgery. Rosie, I think, was 2 or 3 weeks of hand feeding. And you know the old saying of never bite the hand that feeds you? Yeah, they bite.
Oh my
They're they're starving.
Yeah,
And
yeah,
they can
I
only
can
have
imagine.
little balls of mince, but I tell yeah, God knows, they were definitely biting the hand that feeds them. There were a few times where I thought I was not gonna go
Oh
that I
gosh.
was not gonna have a finger left. You know your
Oh,
pug's
well,
feeling
better than
better.
not eating.
Yeah, I was gonna you know
Yeah.
they're better when they're biting your hand to get to their dinner.
Yes. Yeah, exactly. Yeah, as soon as we see some sort of, spicy animal that we know is normally aggressive not be that way, we're like, "Oh, something's not right." And then when they start being that way again, we're like, "Okay, this is good news."
Okay.
Yeah.
But now probably the other thing that it doesn't always happen at adulthood. It's kind of one of those things that happens between adult pug, which is the 1 to 6 years, and senior pug, which is
Yeah.
kind of the 7 to 10, is their eyes. And it's, I
Yes.
think, if anything, the challenges start in the adult years and then they kind of come to roost in senior years if they haven't been addressed.
Yeah, absolutely. So, yeah, as you've experienced before
Mm,
from my knowledge is that
mm.
one of your pugs had dry eye, which then led to blindness.
Yep.
Which, yeah, we definitely want to avoid, and that was from your understanding was from just a lack of treatment from,
Mm.
early on. So,
Yep.
because pugs have their big sort of bulging eyes, they can't actually blink properly. So, because of that, that can then lead to dry eye, and it can also lead to things like ulcers within the eye as well.
Mm.
They also, I'm sure if you've ever seen any sort of brachycephalic animal, especially you'd probably notice it more in, your white dogs or your white cats, the discharge underneath their eyes, that's
Mhm.
just due from their tear ducts not being able to function properly. So we can also see that in pugs as well. So there's a few different issues, yeah, with eyes that can occur. So yeah, if you're noticing redness, if you're noticing them squinting,
Mm.
anything that you just look at and you go, "Oh, that eye doesn't look right," take
Yep.
them to the vet straight away. We never wanna wait on eyes because, yeah,
Mhm.
things can go downhill really, really quickly.
Oh, yes.
So yeah, if anyone says, "Oh, my cat's or dog has got a little bit of a sore eye," we just say, "Hey, let's just get him in today or tomorrow as soon as we can."
Mm. No, and sort of I think Rosie has it, Kenji has it, Buster has it because of his dry eye, pigmentary keratitis.
Yeah.
So it looks brown, but it's actually blood or old blood crusting over the eye. And I think the worst part about the condition is that initially, because their eyes are so dark, you don't actually notice it starting to form. And
Mm.
then sort of when you, and I know for me, especially with sort of Rosie, Kenji, we caught it quite early, but he had a lump on his eye that was rubbing his eyeball, which is how it sort of, so anything rubbing on the eyeball causes it. Um,
Yes.
so with Kenji, he had a little lump, little cyst that had sort of developed on his eyelid. So because we were paying attention to the cyst, we saw the pigmentary keratitis start. But with Rosie, it
Mhm.
actually started on the inside of her eyes. So it
Oh,
was almost masked by her eye color.
yes.
And it was only through like just catching, like sitting next to her on the couch and catching just the light in her eye at that right angle that I went, something's not right with your eye. And then
Mm.
I went, oh my God, I know what this is. Sort of, and I'd never had a pug up until Rosie that had it, but I'd heard enough about it to know, damn, I need to go in and
Yeah.
sort of, and so all the puppies have eye drops now. So, and it is what it like the teeth, if it's something that you start off with early, or catch it early, then the eye drops, I think, I mean, I don't know, like the ones that we use with the eye specialist, it's about $100 every couple of months.
Yeah.
Um, that doesn't include the vet appointment, obviously, that's just the eye drops. But
Yes.
if you get to it early enough, it actually gets rid of it. If you don't get to it early enough, you're doing it for the rest of their life.
Yeah. Yeah. So yeah, definitely, yeah, getting in sooner rather than later with your eyes is so important because yeah, as you've
Mm.
literally seen, they can actually go blind from it.
Yeah.
So yeah, and I guess the other thing as well is that often, and this doesn't just go with eyes, but it could also go with other things like ears, for example. If your pet has had an eye issue or an ear issue, don't just use the drops that you were dispensed last time
Oh,
because it might be something different and it can actually affect it way worse and can make it a lot worse. We hear it so often, unfortunately, because people don't want to come back in. They say, oh, yeah, I've got this eye drop from last time, that they didn't have an ulcer last time. And now they do when they're actually irritating it. So
yeah.
that's something I thought I would just mention
No,
because
absolutely.
it is something that I hear often. So yeah, and expiry dates as well. You know, oh, a year ago they had an eye issue, and I thought I'd just use this, and yeah, it's probably one of the worst of things that we unfortunately do here because we don't want that pet to be in pain with something that's expired or something that's not the right drug for them.
No, agreed. And I think luckily we've never done it, but I have heard of people who have ended up deafening their dog because the ear flush that they've used has, I don't know how true this is, but has burnt the inside of their ear or their eardrum, or it's done something to their eardrum and it's actually made them permanently deaf.
Yeah, it's definitely possible. I guess it depends on what product they were using. And again, yeah, was it
Mm.
expired? But yeah, chronic ear infections, they need to be managed correctly. And that's something the pugs can get too. They've got their little
Because their
floppy
ears
ears.
flop over and
Yeah, yeah,
there's no way for debris to come out. It was actually,
yes,
um
exactly. Yeah.
so no, you just, I look at them. The first vet I ever had with fat dog said to me, "I love pugs. They're a big dog in a little package with all the big dog problems, with no
Yes.
space to deal with
Exactly.
them."
Yeah, even other things, like skin issues as well. Yeah, with their little folds too. So there's
Yes.
a few different things, unfortunately, that we have to keep a closer eye on for pugs.
And that's actually a good point because nose fold, especially keeping clean, that's all ages from puppy all the way through to the day that they pass
Mhm.
away. That is because it's, is it bacteria? No, not bacteria. What is it they get in their nose fold?
I would
Yeah,
say it would be some form
it's
of
sort of, it's like a
bacteria.
yeast. I'm trying to think of it like,
Yeah,
yeah.
yeah, yeah. Yeah, yeah, yeah. So they can get, yeah, yeast and bacterias in there. It just sort of really depends on what it is, I suppose. But yeah, you'd notice the sort of moistness or the brown discharge or the smell of it as well, is usually quite noticeable. So yeah, keeping the folds clean, especially from young puppies, desensitization for everything is really what I say.
Mm.
Your ears, your nose, your teeth, your nose folds, your everything basically. So I remember I'll just say very quickly because it's funny now that I think about it, but it was not funny at the time. I remember I did puppy school and I was saying those things. It's like desensitize everything, and I was like, "Oh, I'm desensitized for temperature," and I was like, "No, I'm desensitized for that." And I think I almost cried after that because everyone's face was very shocked, and so was mine. I actually hadn't thought that for a long time, so that's hilarious. But yes,
Oh,
desensitize everything else.
decent, yes. So, but no, and like a nose fold thing, although it probably I think the worst that could happen is they would need antibiotics
Yeah.
to deal with any bacteria or anything else. But a quick nose fold clean once a week, or if they're really bad, a couple of times a week, is a lot cheaper than having a run of antibiotics.
Oh, absolutely. Yeah. And yeah, you don't need anything crazy for it as well. You would just need, some sort of
A wet
I
facial.
think pet stores sell like, wet wipes for that
Mm,
exact purpose. So something like that, or even just, like tissue or something would be fine as well.
yeah.
Just make sure it obviously is sensitive for them and
Mm.
suitable for dogs. But yeah, absolutely. Just giving them a good clean out is gonna hopefully save you money on antibiotics in
Oof,
the long run.
have another vet
Yeah.
visit. So we've
Yeah,
kind of
exactly.
we've kind of transitioned into the senior pug role. So the one thing I will say is the stuff that's transitioned from adult to senior still applies. So they still need to have an annual check, but I know that there are extra things which we will talk about.
Yes.
They still need to have vaccinations.
Yeah.
They may or may not get their teeth done because of their age, because
Yeah.
there is
Most
then
likely,
the
yes.
ch
Oh,
yeah,
unfortunately.
depending
Yes.
on how their blood test goes as to whether or not they're gonna be
Yes.
suitable for, because as you mentioned, it's actually quite a lengthy procedure, and
Mhm.
being a senior pug introduces other challenges.
Yes,
Um
absolutely.
Keeping their eyes looked after, keeping their nose folds looked after, all of that stuff, looking after their weight, all that stuff still applies. So
Yeah, I was gonna say weight, the big one. Yeah.
everything from adult transitions into senior. So, but the idea is if we followed all of this advice, we've gotten through adult with few challenges, and we're going to get to senior with few challenges. But there are some things that, because of their age, that you do need to be aware of, and you really should book in and pay for. So, first thing, senior pug annual check. Why is it
Yes.
different to a normal pug annual check?
So yeah, so that will be more of a comprehensive check over with the vet. So they're gonna check things like the heart rate, see if they have a heart murmur, listen to their lung sounds, check sort of their all over body condition score as well. So things like their weight. Yeah, because your senior dogs are not moving around as much, so they're probably gonna be more
Trot on.
prone to weight gain. After already being a breed that is already prone to weight
Yeah.
gain. So something that we definitely need to keep an eye on. Other things as well would be like your arthritis as well. So,
Mm,
do they need something potentially to make them comfortable for their arthritis? Yeah, so there's a couple of different things that your vet's going to check, and often they will recommend potentially, 6 monthly to annually blood tests as well. So just to check and see sort of where they're at. Is there any changes that are concerning, or are they, happy, healthy, which would be great.
absolutely.
So yeah, just keeping on top of all those sorts of things and seeing if there is any underlying issues that we do need to address in their senior years.
Now, if I remember correctly, because it's been a while, I think Rosie and Kenji are probably due for their senior pug blood test, but I think it's about $100 for the blood test to get it done, thereabout.
Unfortunately, it's a bit more than
Oh,
that.
it is. Well, it just
If
goes to
you
show how long it's been since the
yeah.
last time I've done one.
Yeah, so usually a more comprehensive blood test is most often the vets depends on what machines they have in clinic. If they have, your high-end machines, they might be able to do it in-house, but usually we'll send them off to a laboratory to
Mhm.
have them fully run. Usually, I would say they're sort of just under $300.
Mhm.
So they are quite costly. So you may not be required to do them every 6 months. It might be just, annually or so. Just really depends.
Yeah.
Sometimes it might be more frequently if they've got an issue, but then that might change the blood test as well to be something else. But just for like your sort of standard wellness comprehensive tests, usually just under $300.
And it does I feel like it tests absolutely bloody everything.
Yeah.
There's like
Yeah.
it's almost like it's a surprise if something crops up that hasn't been on the blood test. That's definitely how I always thought whenever we've, taken any of our pugs in to do their senior blood test.
Yeah, so I guess it also depends on what they're looking for as well. So they might add on certain things or do certain things. So say if your pug has a kidney issue, they might sort of adjust the test to sort of reflect that.
Yeah.
But yeah, the comprehensive wellness ones usually sort of give you an overall view of sort of what is going on,
Mm.
but it's not going to detect things like cancer. It will just give us sort of an idea of sort of what's going on in the body and do we need to explore that further. So do we need to do some more testing? Do we need to do blood? Do we need to do ultrasound? Do we need to do x-rays? Do we need to do
Mm.
so forth? It really just sort
Yeah.
of depends on what's going on and do we need to, just do a further workup on them basically.
Yeah. No, but it's so worth doing. That's the one thing that I can
Yeah.
say. Um,
Yeah, and I would say that your geriatric age is probably gonna be the most costly because this is
yeah.
when we start to see all the issues come forward.
Mm.
And it's not gonna be cheap, unfortunately, unless you've got pet insurance, which might cover some costs, but I can't say that they're gonna cover everything.
No.
So, yeah, it's
Yeah.
tricky.
And so geriatric is 10 plus years. So the hope is that if you've done everything as best you can leading up to the senior/geriatric period, you're not going to have too many challenges. It will be sort of the typical things which we haven't actually covered quite yet. But so it's arthritis. Arthritis is the big one that I think
Mhm.
every pug I've ever owned has had some form of arthritis, whether it's just from old age or if they've got hip dysplasia or
Yeah.
or knee issues, lactating patellas. And so if we can quickly I know we didn't actually discuss this beforehand, but it is something. So there are a number of ways that you can manage arthritis to improve their quality of life.
Yeah.
From injections to tablets. Are you able to quickly cover it? I'm really sorry if I put you on the spot.
No, no, that's okay. Yeah, so yeah, I guess, and what causes arthritis as well is those senior years, but have they had issues previously with their knees or hips, or have they had a TPLO surgery or something
Mhm.
along those lines? That might also lead up to being more prone to arthritis. But yeah, so definitely a few different things that can be helpful. So there can be sort of supplements over the counter that you can purchase.
Mhm.
Then there can be your monthly injections or 3 monthly injections. It depends on what they require. There can also be tablet forms as well. Things like radiology will give us a bit more of an idea as to exactly sort of what we're working with too. So sometimes that might be recommended. Not always though. Usually it can be sort of managed via the medications as well. But definitely your senior dogs, we do tend to see, them have the monthly injections usually as well as your supplements on the side to help
Yep.
manage it as well. So yeah, so there's definitely a few different avenues that we can explore for arthritis just to make them mostly comfortable in their senior age. But the thing about it is as well is with certain medications, they can just feel so good that they just want to go and run around again, but it doesn't actually stop the arthritis from being there.
Mm.
So that's just a consideration as well with your senior dogs. You still sort of don't want them to sort of do too much just because they feel like they can. They may still be having the effects underlying
Mm.
from some of the drugs. So yeah, definitely something just to monitor, I suppose, at home for your excitable pugs.
Yes. I mean, Rosie and Kenji, they're on an amazing regime. I need to come back as one of them. So they have the injections and they also have the foresight. So in between.
Yes.
And so I think the injection is like $40 a week, $40 or $50 a week thereabouts for 4
Mhm.
weeks. And then I think we're starting to get to the point for Rosie, because she's obviously a lot older than Kenji, that the 6-month gap is actually going to have to start shrinking.
Yeah.
So and then they have the foresight in between, and so that. But I know previous pugs have had Sasha's blend, and I think like a tub usually costs somewhere between sort of $150 or something, and then, as you said before, it's about the size of the dog as to how much you're spooning into their food every day.
Yeah.
So it is something that sort of you need to, when you're having a look at the tub on the back of it, actually checking to make sure that you've got the right size.
Mm.
But the injections, I have to admit, I notice a difference.
Yeah.
I'm amazed at the level of dexterity they have by the third injection compared
Mm.
to what they're like. Like sometimes I think you forget just how much they slow down as they're due for their sort of their next round of shots. But you're correct, geriatric pugs, I love them. They're walking them is like tiptoeing through poison ivy, because you can't go any faster than like snail's pace. But they need
Yeah.
to have that time outside to sniff and do all those sort of things.
Mm.
But I think they're well worth the cost, that's for sure. And probably the last thing I will say is a geriatric pug, senior pug, they do have surgery restrictions, especially when they're getting to the 10 plus years.
Yeah. Yeah. Absolutely. I think with any sort of geriatric animal, we always have to just be very, very cautious when we're doing our anesthetics. So yeah, you're watching out for things like your blood pressure, your heart rate, all those sorts of things, that respiration rate, all that sort of stuff. It's yeah, it's funny usually when we do, well, not funny, but when we do surgeries on pugs, we often find that they don't want us to take the ET tube out because they're breathing so well with it. So we do tend to leave it in a little bit longer for our brachycephalics as well. So that sort of goes hand in hand when we were talking about the BOAS.
Yeah.
But yeah, definitely there can be some more sort of risk factors. So that's why we do things like our blood tests prior to, or, all of our senior checks and health checks, and see if, they are suitable for an anesthetic. And then, just countering those risk factors. So whether or not we need to change our pre-anesthetic medications to suit them, or
Mhm.
post-operative drugs, our fluid rates. Yeah, there's a lot of considerations that go into the surgery itself and whether or not it's suitable. Or, if we can do things, say like an X-ray, can we do that conscious? Or an ultrasound, can we do that conscious? Because we always want to avoid doing an unnecessary anesthetic if we don't have to.
Mm.
Yeah, for the safety of the animal. So definitely a few things to consider when putting your older animals under anesthetic, and also how long they're going to be under anesthetic as well. So like I said before, your dental's quite a long surgery. When most likely not going to put them under for as long. We're going to probably half that surgery and then maybe do another half down the track as we need to. Yes, just to make it a bit shorter for them.
Thank you so much for your time today, Chelsea. It's been an incredible conversation, as I said, one that I wanted to have for quite a long time. So that people understand that from cradle to grave, this is your pug life. Like, we talk about all the wonderful things, and pugs are absolutely wonderful,
Yeah.
but we rarely talk about the hard things about the pug life. And unfortunately, a majority of those hard things are health related, whether we like it or not. And so I think
Yeah.
forewarned is forearmed. And sort of, hopefully the audience agrees with me that it was definitely worth. We've probably talked longer than any other podcast I've ever had, but it has been absolute gold for the entire time,
Yeah.
because it's even for me, like 5 pugs, 20 years. I'm still learning new things, and it was fascinating to hear, especially about the surgeries. I will definitely be looking at my vet differently the next time somebody has to go in for a dental procedure. That's for sure. And I possibly won't
Yeah.
complain about how much it cost.
Yeah, maybe bring them a box of chocolates.
I
They
should
will love it.
actually. Thank you. Thank you for extracting all those teeth.
Yeah.
For putting up
A
with my
chocolate for every tooth, I think would only be fair.
wonder if I can get pug-shaped tooth chocolates. That's probably the better
Oh,
way.
beautiful. Love it.
Thank you.
We're all weird. We love
Oh,
it.
thank you so much, Chelsea. Now, if people wanted to reach out, obviously they can reach out via the Facebook group, but if they wanted to reach out to you and ask something a little bit more specific, how can people find you?
Yeah, of course. So they're more than welcome to reach out to me via the Good Dogs Cookie Club. So my Instagram page is just at the Good Dogs Cookie Club. So just send me a message via there and I'll be more than happy to chat about anything with you.
No, that's awesome. Thank you. Thank you so much for your time today. You've been absolutely wonderful. And I can't wait to get you back onto the show to talk about the next important pug topic. But we'll figure out what that is first.
Sounds great.
And that's a wrap on part 2 of our special Pug Health and Wellbeing series. A huge thank you again to Chelsea, the vet nurse, for guiding us through the ups, downs, and snorts of pug care beyond the puppy phase. From adult health needs to the gentle love and attention our senior and geriatric pugs deserve. We've talked about managing mobility, dental care, and how to prepare emotionally and financially for the later chapters of your pug's life. It's not always easy, but it is incredibly important. And with the right knowledge and support, you can give your pug the comfort, dignity, and joy they've given you all along. If you haven't already, go back and check out part 1 for everything you need to know about caring for your pug from 8 weeks through to 1 year. Together, both episodes are your full guide to raising and loving a pug through every life stage. And don't forget to pop over to our Facebook group, the Pug Life Show Podcast, and share any aha moments. If you're not a member of the Facebook group, I invite you to join now. And whilst you're there, let us know what you think of the podcast. We love getting feedback and it helps make sure that we do better for you every season. Plus, if you haven't already, please subscribe to the podcast so you don't miss out on the next episode. And while you're at it, leave us a review. It only takes a couple of seconds to give us a 5-star review, and it goes a long way to helping Pug Pawrents find us. Rosie, Kenji, Buster, and I hope that you will join us again soon. But until then, have a pawsome week. And humans, be generous with the snackies.